Welcome, everyone. Hi, I'm Gretchen Curry. I am the founder and president of StaffLink. StaffLink is a St. Louis-based healthcare company. We provide primarily home care services to seniors, and we also do provide medical staffing. I am here today representing StaffLink, and in particular, our home care division. And I'm also here representing Senior Resource Options. Senior Resource Options is an organization made up of owners of businesses that provide services to seniors. And we provide educational programs on different organizations, products, and services that are available to the older adult population throughout the region. Today, I'm thrilled to be here with Amy Neu. Amy is has a master's in social work that she earned at Washington University. She is also an LCSW, a licensed clinical social worker. Amy is affiliated and associated with West County Psychological Associates. She is currently the Assistant Director of Senior Services at West County Psychological Services, and she is a certified dementia care specialist. West County Psychological Associates is a comprehensive mental health organization and consulting service provider. Their diverse group of mental health professionals provide psychotherapy to individuals, couples, and families, and consulting to organizations. Today, Amy and I are here to chat about seniors and depression. Amy, thank you for joining us.
Oh, hi. Thank you for having me, Gretchen. I always love speaking with you.
So, Amy, my first question for you, tell us about the services you provide as a licensed clinical social worker.
Sure. Well, in my role at West County Psychological Associates, I provide assessment and counseling for older adults and their families. So what I do on our initial session is I'll go through and I'll do what we call a biopsychosocial spiritual assessment. That way we get a clear picture of how the person is functioning physically, mentally, socially, and also spiritually. And from there, we develop a treatment plan with the client and work towards their goals.
Okay, good information. My first question then regarding seniors and depression. Amy, tell us what we, and when I say we, I'm talking about seniors, their families, or people like myself who work with seniors. What should we understand about seniors and depression?
Sure. Well, there is so much that goes into it, but I think the main points are that depression is not a normal part of aging. I think that there are a lot of assumptions about older adults in this population, and they're not accurate. I think that another piece that is important about older adults in depression is it's not just sadness. It can come out in a lot of different ways. It can look like appetite changes, sleep changes, tearfulness, anger, irritability, or forgetfulness. It can also be kind of expressed in what some people call refusal of care. So it could be someone who doesn't take their medications that are prescribed, somebody that is refusing to get care in their home if they're really needing it. It can come out in all of these different ways. So it's not just crying or sadness. And the last thing I want to say too is that older adults are very responsive to treatment for depression. Again, that's another kind of myth, but I have had a lot of clients who come to me initially for depressive symptoms that have made wonderful progress and then achieved a healthy level of functioning. There are also a lot of different medications that are also effective with this population. And so conversations with their physicians are also very, very helpful.
Oh, I'm going to ask a question that maybe I should have asked first. Amy, define depression.
Oh, that's a wonderful question. So depression, when you're looking at it clinically, is a kind of a 2-week or longer period where people have a lot of different markers. So some of the things that I discussed earlier, the appetite changes, the sleep changes, persistent low mood, those all can contribute to a diagnosis of depression. So for someone to be diagnosed with a major depressive disorder, and these can be a single episode or recurring episodes too. They would need to see somebody like a therapist or a counselor or a psychiatrist, and they could get a formal diagnosis. But a lot of times, if you're noticing that either yourself or your loved one is showing some of these signs, that's more than enough to have a conversation with a professional.
Okay. And that's a good mark, 2 weeks or longer.
Yes. And also not as a response to grief. You know, that's usually something that's considered a different topic.
Good information. So Amy, my next question would be, is how should a family work with the senior, either independently or with a professional like yourself, to address this issue of depression?
Yeah, I think that the first step is opening up a conversation. And this is a conversation that should avoid kind of mandates. It shouldn't be going in and saying, Mom, you need to do this, or Dad, you've got to do this. That usually isn't effective. Opening a conversation up with some things that you've noticed, I think, is the best way to approach it. So if you've noticed that your loved one isn't eating as much, or you notice they aren't sleeping, or you notice that they are just doing different things, you know, their shades are drawn in the house so they don't have light coming in, all of these different little things, notice those, and then you can use those when you bring up the conversation. Say, you know, I'm concerned, I've noticed this and this, I've been wondering, how are you feeling? And then they have to put it in their own words. You can then make suggestions about contacting someone to help them talk through it and make sure they're doing okay. So if you're noticing a lot of physical symptoms, for instance, you could even say, I think we should make a doctor's appointment. Let's go in and talk to your doctor about these things. And a lot of times, if somebody's not open necessarily to going straight to therapy, they would be open to having a doctor's appointment. So everybody's a little bit different, but I think those are some building blocks on conversations. And if they shut the conversation down, give them a time frame you're planning to follow up with them and say, well, okay, if I'm noticing you're still not doing so well in a couple of weeks, I'd really like to bring it up again, and leave it at that. Sometimes it can take a couple of conversations.
Okay. So you touched on something that I have a question about. Older clients, you find often respond very well to treatment.
Mm-hmm.
Do you find that older clients, baby boomers or beyond, are not as responsive and open to sitting down and talking to a professional? Is that a myth also?
That's a wonderful question. I think that there is a lot of stigma still in that population. That is very true, because a lot of the messaging they got, you know, when they were being raised and moving forward was, you know, we don't suck it up. We don't talk about our problems. Don't air our dirty laundry. Those kinds of things were very much in the messaging they got growing up. So I think initially it can be a little bit harder for them to agree to sit down. But once they do, I think that's the big thing. You know, I have a lot of clients who've come in and their loved one said, I don't know if you're going to get anything. They really didn't want to come see you. And I said, well, let's come in and we'll just see, we'll just talk. And then once they start talking and realizing that it's more a discussion of options and it's somebody to listen and be supportive, then it's not so scary. I think a lot of them have that idea of sitting and laying down on the couch and being, you know, having somebody write everything. And that's not therapy these days. And so I think once they see that, it's a big help.
Okay. So Amy, what local resources besides West County Psychological Associates, what local resources are available to seniors and their family?
Yeah, I think we're really fortunate in this community. We've got a lot of wonderful agencies and organizations that provide support. So SLU, St. Louis University, has a geriatric psychiatry clinic that's very well respected, very good. UMSL also has counseling for older adults, and they do it on a sliding fee scale, so it is more affordable. Mental Health America of Eastern Missouri is a great place to get information on depression in older adults and resources. And also looking at something like a care management agency, I think can be helpful as well in terms of getting support, getting connected with medical professionals if you're needing some help with that too. So Care Choice Care Management is a wonderful one. I know you do great work at StaffLink, getting people help in what they need at home too. So all of those.
Okay, that made me think of another question. So since we're talking about seniors and most of them are receiving Medicare services, are you familiar with any counseling services that will make in-home visits to seniors that maybe can't get out as much as others?
Yes, actually, we do that at West County Psychological Associates too. Transportation is such an issue. You know, if somebody isn't driving anymore, that's an extra burden on them and the family. And so we go on site into individual homes and facilities too. Yeah,
I think that's great because I think sometimes people are more comfortable in their own environment. Yeah. So, Amy, we're going to wrap up here by me asking if someone wants more information from you on this topic or more information from you on West County Psychological Associates, how can they contact you?
Sure. Our office number is 314-275-8599, and my extension is 178. And then you could also email me if that's easier. And my email is amy.neu, and that's NEU, and the number 1@gmail.com.
Well, Amy, again, I thank you for taking the time to sit down and chat with us about a very important topic and to clarify a few things for us and to provide some resources for families and seniors to consider if they're looking at this issue.
Oh, thanks for having me, Gretchen.
Thank you.